Hello, everyone, and welcome. Members of the psychology team through ECSD have put together this information as a resource for parents to help children cope with anxiety. This is part 2B of our Working Through Worry series. In this presentation, we'll focus on breathing, an important component to managing anxiety. In part 1, we have learned about anxiety and recognizing when it becomes a problem. If you have not already, we encourage you to review this information first. Now, on to breathing. What is a big belly breath and why is it important? A big belly breath is also called a controlled breath, meditative breath, or deep breathing. The purpose of this is to slow everything down. It is a breath that comes from your diaphragm, your belly. When a person feels stressed, their heart rate tends to increase and they tend to take faster and shallower breaths that are from the upper part of their lungs or their chest. This in turn tends to make the muscles in our bodies tense, and it can become increasingly difficult to think clearly. If nothing changes, our thoughts, body, behavior may become stuck in an anxiety loop. But if we are able to take a moment to pause, a moment to take deep breaths, we can trigger the parasympathetic response, sometimes called a relaxation response. The increase in the amount of oxygen releases a sense of calm throughout the brain and body, lowers blood pressure, reduces heart rate, relaxes muscles, and can focus your mind on your body. That's why these breaths are so important. They're also preventative in that if we are able to engage in deep breathing from the start in anxiety-provoking situations, we may not experience all the symptoms we might otherwise experience. So how do we belly breathe? The first thing in belly breathing is to take a deep breath in through your nose. As you inhale, you fill up your lungs and belly, and then try to breathe in just a little bit more. Hold for a second, and then exhale through your mouth. Exhale until there's no more air left in the belly and lungs. This is a conscious body breath. For young children, we want to make this learning as concrete as we can. We might do this by having them place their hands on their belly and feel them rise and fall as they inhale and exhale. Or we may ask children to fill up their stomachs, making it as big as Santa Claus's belly. Let's practice. Inhale as the shape expands. Remember to inhale through your nose, fill up your belly, and then exhale through your mouth. Let's begin. There are many ways that we can help children learn to belly breathe. Here are some visuals that you may want to use in your practice. In the first visual, the square, children trace along one side as they inhale to a count of 4, trace along the second side as they hold for another count of 4, trace along another side as they exhale to a count of 4, and trace along the last side as they hold for another count of 4. With the figure 8 breathing, children inhale as they trace their finger around one way, and exhale as they trace their finger around the other way. It is important to be able to do this breathing exercise often. The more practice we have, the more natural it becomes, and the more likely we are to use it when needed. Practice with your child and model big belly breaths yourself. If you feel as though you're getting anxious or frustrated, stop. Take 3, 5, even 10 big belly breaths. You'll slow your body down and be able to refocus on what is causing you to feel this way. This is the same thing you could do with your child. When you notice that they're starting to get agitated or starting to look restless, pause. Initiate a big belly breath activity and do a few together. The more it is practiced, chances are the strategy will become internalized. So remember the 3 important components to belly breathing. First, breathe in through your nose and let your belly and lungs expand as much as possible. Second, exhale slowly through your mouth until there is nothing left. And third, do this as often as needed. Here are a few resources for you and your child. Videos and apps can be a fun way to incorporate the breathing practice into your daily routine. Thank you so much for following along with this presentation. The psychology team has created a PDF handout for you that reviews the information discussed in this presentation and provides direct links to resources. Take care, and please check out the next part of our Working Through Worry webinar series.